Good morning, everyone. I am Reynovel Mateo, the current Program Manager of the Integrated People-Centered Health Services, or IPCHS program, under the Policy Planning and Program Development Division of the HFDB. Today, the orientation shall be divided into three parts, which include the overview of the IPCHS, orientation on the DM 2022-0530, and a walkthrough of the Standardized Primary Care Facility Client Experience Survey, or PCF-CES Tool for short. Let me now briefly begin to introduce to you the IPCHS program. The IPCHS program started as a commitment to the 69th WHA and 31st ASEAN Summit. This was incorporated into the PDP for 2017 to 2022, which called for the enhancement of the social fabric, or in Filipino, malasakit. This led to the creation of the Malasakit Centers Act, which adopted the policy framework for the integrated people-centered health services to address one of the non-clinical outcomes, which is responsiveness. By WHO definition, responsiveness is the ability to meet the population's legitimate expectations regarding their interaction with the health system, apart from the expectations for improvement of health. Since the adoption of the policy, we have been able to craft an administrative order which provides the framework that guides national and local actions towards the institutionalization of IPCHS in all health facilities to ensure responsiveness to the needs of its clients. In 2022, we have launched the Hospital CES tool, and we are currently monitoring its implementation on a biannual basis. An example of the report is provided on the left side. Last year, we have also expanded the tool to primary care facilities through DM 2022-0530, which will be the focus of this orientation. And with the recently prescribed client satisfaction measurement of the Anti-Red Tape Authority, the DOH has harmonized these tools for compliance. As for the next steps, please do anticipate the development of the IPCHS dashboard and the revision of the DOH Academy course. Let us now proceed with the online orientation of the DM number 2022-0530. So what is the reason why we developed a standardized tool for the PCFs? The use of a standardized form to measure client feedback cuts across multiple policies, namely AO number 2020-0003, or the Strategic Framework on the Adoption of Integrated People-Centered Health Services in All Health Facilities, AO number 2020-0034, the Revised Guidelines on the Implementation of Continuous Quality Improvement Program in Health Facilities in support of quality access for universal health care, and AO number 2020-0037, which is the Guidelines on Implementation of the Local Health System's Maturity Levels, each of which will be further discussed in the following slides. The Administrative Order number 2020-0003 enumerated the three strategies that comprise the IPCHS framework, which are to ensure and promote an organizational culture geared towards responsiveness, ensure appropriate infrastructure and processes in health facilities, and promote client engagement and empowerment. Specific activities under each strategy that health facilities can do were also provided in the said policy. Under the first strategy, health facilities shall equip their staff with necessary skills or training to ensure good interaction with patients, carers, and their families. Their HR shall also assess their health facility staff on the quality of their interaction with clients through patient feedback and recognition mechanisms as patient care champions. Under Strategy 2, health facilities shall ensure that the physical condition of their facility will promote healing by addressing the total sensory environment. Establish effective and efficient patient navigation within and across health facilities. Employ patient flow analysis and data-driven facility management in improving overall operations of the facility, and harmonization of processes to reduce redundancy of work. Lastly, under the third strategy, the health facilities shall implement mechanisms to ensure that the patients, carers, and their family are informed of their condition and are involved in the decision-making for their health. Mechanisms to create a participative environment for patients, carers, and family by engaging patient groups in the development of policies. Incorporation patient experience to measure responsiveness of the health facilities, and provide avenues for social responsibility programs to advocate good health-seeking behavior. As for the AO number 2020-0034, which provides an updated policy on continuous quality improvement program in health facilities, highlights include the expansion of scope and coverage to include all health facility regardless of ownership and facility type. Streamlined approach in program delivery, treating CQI not as an independent program, but as an integrated framework to marry all facility-based programs and benchmark on current DOH standards. IPCHS and patient safety was also named as a driver for quality care. In effect, all health facilities were mandated to conduct evaluation of the responsiveness as a response to CQI, becoming a component of licensing requirements for primary care facilities. Lastly, AO number 2020-0037 states that the LHSML serves as a general framework in the monitoring and evaluation of the progress of the LGUs that committed to the integration, and shall provide the pathway to progressively realize the integration of the local health systems into province or citywide health system. It shall be used in complementation with the LGU Health Scorecard and other existing monitoring and evaluation systems that track LGU performance. For these purposes, a standardized tool to measure and monitor the responsiveness of primary care facilities towards people-centered health services was developed. Here are the two policies providing guidance on the developed Client Experience Survey tool for hospitals. The tool wishes to standardize what is being measured across the different facilities, standardize the process of collection, and standardize reporting. Take note that the HSS tool has just recently replaced the standardized CES tool to allow harmonization with the CSM tool of ARTA. The standardized tool for hospitals paved the way to develop the PCF-CES tool, which involved the following steps: creation of the tool, which was based on the standardized CES and Primary Care Facility Manual of Standards; validation of the contents by inviting selected MHOs and RHPs to evaluate the drafted tool; evaluation of the tool's phase validity through pre-testing; and finally, pilot testing to 4 randomly selected municipalities. The PCF-CES tool was then issued out as the DM number 2022-0530. This was entitled Interim Guidelines on the Implementation and the Use of the Standardized PCF-CES Tool to Measure Responsiveness in All Government and Private Primary Care Facilities in the Philippines. Harmonization with the client satisfaction measurement prescribed by the ARTA was also most recently done. Now we move on to the general guidelines of the DM number 2022-0530. All government PCFs shall utilize the standardized PCF-CES tool as a means to harmonize the measurement of responsiveness, while private PCFs are also encouraged to utilize the tool as a customer feedback mechanism. Reports generated from the tools shall be used for the facility CQI, serve as a basis for quality and people-centered care, and compliance for the KRA in LHSML. For the survey administration and collection, the tool shall be administered after a client is done with their completed transaction. It should be self-administered and voluntary. English and Filipino translated tools shall be used without modifications. The tool may be translated into the appropriate dialect used by the facility. Quota sampling method will be employed, and electronic or online platforms may be utilized to facilitate the collection. All related tools shall be accessed through the link on your screens. For the report generation and submission, the PCF shall encode data in the PCF-CES online report generator. The administrative unit will analyze and submit the reports. The designated personnel in charge shall sign a non-disclosure form, and the consolidated report shall be submitted to the HFDU by January of the succeeding year. The HFDU will then collect and validate the report submitted by the PCFs and submit a regional PCF responsiveness report annually in March of the following year. The regional PCF responsiveness reports should be submitted to the IPCHS program email, and the generated report will be used to monitor the performance of the health facilities. For the review of forms and processes, HFDB shall review the forms and processes for collecting the survey annually. PCFs may send their suggestions and inputs for the improvement and more efficient implementation of the PCF-CES tool through the HFDUs. Flashed on your screen is the prescribed implementation timeline. So we are already done with the first and second quarter of the year, and we are already holding the dissemination and orientation of the PCF-CES tool and the demonstration of the PCF online report generator today. So, next will be the regional responsiveness report, which shall be held on June. The start of utilization of the tool will be on the third quarter. And then, on the first quarter of next year, the consolidation of the reports shall start. For the roles and responsibilities, the PCF shall implement PCF-CES tool, submit responsiveness reports, validate and analyze results, and act on recommendations. The CHD and MOH BARM will be monitoring submissions, provide technical assistance, conduct capacity building, consolidate regional responsiveness reports, and provide feedback to the PCFs. The HFDB, on the other hand, will provide capacity building, coordinate with HFDUs, analyze and publish consolidated reports, conduct implementation reviews, and provide recommendations. Here is a screenshot of the primary care facility client experience survey tool. This is the questionnaire. This, on the other hand, is the online report generator. Both the questionnaire and the online report generators should be copied by the facilities so they may be able to edit them. So now, we shall now proceed to the walkthrough of the PCF-CES tools.